Hello Malaysia, and welcome to the final episode of Medical Today. I'm Jared Ratnam. This brings us to episode 15 of season 1. So it's been quite a fantastic ride for all of us working on this team, working with the executive producer down to the crew members, having a lot of fun bringing this to you. Now, while we were having fun, there was a lot of research being done in the background as to who to bring on, the phenomenal doctors that appeared on the show, how we were going to get questions or talk about certain topics. All these discussions were rather interesting and was also informative on our part as crew members. Now, what we're going to do today is walk you through what we've done in the past 14 episodes, this being the 15th. We'll start with the first one we took a look at, which was Dr. Google. Now, most of us go online and try to diagnose or look for research or look for advice when it comes to being sick, or if there's something wrong, not right with us. We're always going to Dr. Google.
Yes, I do check. Normally, I normally every day I'm using Google.
For us, logically, we will approach to we'll visit the medical doctor first to see to seek what's wrong with us.
Talk about getting medical information from the search engines like Google. Yeah, for my personal opinion, you can do it, but you have to make sure it is from a reliable source.
Guilty.
Now, but how do you know whether it's a reliable source or not? There's a few things that you need to look into. Number one, assess the credibility of the content owner, right? Are they from a professional body? For example, WHO, the majority of us.
Yeah, but I remember the good old days. Things have changed now. I remember the good old days when you have a hip pain, you walk into the pharmacy and say, hey, can I have 10 days worth of ciprofloxacin? And I'll have some NSAIDs to go. And but these things have changed, and I think it's better controlled now.
Yes.
What are your thoughts on this?
Yeah, thank you, Jared. I think certainly in our business we're committed to patient-centred care. So the more information patients can have and be involved in their treatment, the better the outcome.
So that was something with regards to Dr. Google and how we all clamor to get information when there's something wrong with us or family member. Now, you must always take into account that most of the symptoms of what you see always occurs in most of the diseases around the world. It's kind of the same symptoms. So sometimes, you're probably having a tummy ache and, the symptoms look like you're having bowel cancer. So you need to be careful as to how you decipher this information. Like I said before, and I'm going to stress once again, always make sure you're getting your information from a healthcare professional. Another thing that needs to be looked at with regards to being healthy is your work-life balance. So we did speak to Zulhazri Razali from Pharmaniaga Berhad. He's a pharmacist from the commercial division. He's also a director.
It's all about your capacity of your physical and mental in order for you to do your daily thing. Mm-hmm. All right. When you talk about your work and balanced lifestyle, basically you got to be clear on the priority of the day. All right. Yes, you got to work daily, or maybe some of them work at night. But there must be a point where you've got to stop and you've got to shut down your body.
Now from there, In one of our earlier episodes, we took a look at medicine being genuine or fake. Now, when we talk about medication or medicine in Malaysia, all of us, which includes me, we're always looking for that one pill which will take away all our diseases, but that's never going to come. That's something we always wish for. But when you talk about that one pill, a lot of people say you need to understand what the pill is about. Is saying if you're buying a multivitamin or you're buying some drugs for some kind of underlying disease that you have, you need to always know what these drugs are or what this medication is all about.
What I would do would be to make sure when I visit a doctor to make a list of the medications I've taken for the last 3 months. Let your doctor know, so he knows that when he prescribes a medicine for you, he knows what you've been on and what you are on. This is especially important for those of them who are on long-term medications like diabetic medications, hypertension medications. You want to tell your doctor, you know what, doc, I'm on these medications. Do you think what you're prescribing for me could give me a side effect because I'm on other medications? It's important to tell your doctor that.
Right. Now, for those of us who are wondering what's happening with regards to different doctors, say some of us, to give you a simple example, some of us work within the city, but we live outside the city. So where we live, naturally, there'll be a healthcare provider of some sort that we go to.
Sure.
Now, where we work at in the city, if you're not well, you're going to go to one of the doctors around you or panel clinic. And it's always good to give them information. From there, let's talk about one of the fattest nations in Asia. It's apparently us. And according to a report, apparently 49% of women and 44% of men in this country are obese. Now, we spoke to Nurhana Nawawi Suri. She's a general manager for customer care from Pharma Niaga Berhad, and she talked about eating healthy. She also talked about the causes of obesity in Malaysia. Let's take a look at that clip.
First, it's actually the most common reason is because of unhealthy food that you take, right? And the second reason is due to the unbalanced diet. And the third reason is because lack of physical activity.
Right.
And the fourth reason, which is somehow not very popular, is lack of sleep.
There you have it, a little something about obesity and how we should look at all times at a healthy diet, balanced diet, healthy food. And always remember, they always say breakfast is king. Now, there's another question that comes with it. Is breakfast king? A little something for us to think about. But also don't forget, 7 to 8 hours of good sleep and physical activity keeps one going all the time. Our final topic for this segment is about antibiotic-resistant microbes and the challenges we now face, not as a country, as humanity. We face a lot of problems with regards to the use of antibiotics. Joining us on that episode was Vanessa Daniel, the Deputy General Manager for Clinical Affairs, and she's also a pharmacologist. She was on the show to give us an insight, or her insights, with regards to the use of this thing called antibiotics. Let's take a look at it.
So to answer your question, what is antibiotics? Essentially, it's a drug, medicines that are designed to treat bacterial infections, okay? And that's it. They don't treat viral infections. They don't treat any other diseases caused by other pathogens. You need antibiotics when you have an infection in your body caused by bacteria. I would be able to practice certain steps that would help prevent or reduce antibiotic resistance. Okay, some of the steps would be, number one, always make sure to use antibiotics prescribed by your doctor. If you're getting this advice from a good doctor, he knows what he's doing, I would follow his advice. Right. Okay, but I would follow his advice to the T, meaning if he told you to take 2 tablets 3 times a day, I would take 2 tablets 3 times a day. Most of us, by day 2, you feel better and you say, I don't want to take it anymore. Now, that's one of the major causes that leads to antibiotic resistance. So,
is not completing your
not
course.
completing your courses. So this is something that you shouldn't be doing.
Right.
And I think if everybody started doing this, following your doctor's advice properly, practicing good hygiene, okay, simple things like this can help to combat.
Hello and welcome back to the final episode of Medical Today. I do hope you enjoyed the first segment. Now, moving into the second segment, we have with us once again Zulhazri Razali, a director and also a pharmacist from the commercial division of Pharma Niaga Berhad. Welcome to the show, Zul. Good to have you back. Now, good news is we just have the ratings out, and apparently we've got close to 400,000 people who've watched the show already. Your thoughts?
Yeah, it's a good channel for...
I want to feel good about myself now.
No, it's a good channel for people to get really a credible medical-related information. All right, the interactive engagement is good, and we're also looking forward to more specific topic in future, so that you can really inform the people that how they can take care of their good health.
I see the first season as a sort of a warm-up, just giving people a general idea of what's what. But you know what? I don't know whether these 400,000 people watched it for someone like me, or they wanted your vitamins. Apparently, we had about 200 inquiries with regards to Citrex, a brand under Pharma Niaga.
Okay.
Tell us a little bit more about Citrex. What's this vitamin all about?
Okay, Citrex is quite a relatively small brand in the market, but we are growing into more newer products under the Citrex brands. Basically, we are trying to get more evidence-based products so that we can put into the market and inform the public that there are things that you can consume or you can take to assist your well-being in your daily life.
So Citrex is a brand that's only going to constantly grow with different products that are going to come under it. Fantastic.
Yeah.
Well, we hope to hear more about Citrex. In the meantime, what's interesting about this program is that it helps create awareness. Now, having said that, how is this going to be a sort of a platform for Pharma Niaga to continue creating an awareness or awareness program, so to speak?
We have a different initiative in order to create awareness to people. Okay, for example, like we have events, or we have what we call engagement with the people to understand about certain disease or certain products we are launching. So these are the things that we keep on continuing engaging ourselves to the stakeholders, so that the awareness of the drugs and the health care is available for them.
Right. Of course, I have a list of questions here, but off the air, we had a very interesting chat about how the market is changing.
Okay.
You know, how the small boys are being eaten up by the big boys with regards to the pharmaceutical industry in Malaysia and the world over. Now, how do you see this playing out for the small guys,
Okay.
It can't end with the small guys losing.
Okay, I believe in consolidation, right? You've got to combine resources, okay? If those small guys selling the same thing, you've got to be able to consolidate yourself, okay? Make yourself better, having a better purchasing power, and you've got to offer your products with the right value, right? Of course, pricing is one thing. Then again, the quality, all right, the what we call the relevance of the product to a certain medical aspect is important, okay. And on that score, I believe you can still be relevant in the market, despite of having all this big chain pharmacy.
Right. And Pharma Niaga has been doing its bit by trying to bring the small players together.
Yeah.
Now, how difficult or easy a task is this?
It's a bit tough, but then again, we always put the bigger picture of it, right? even though those people they are having their own setup, they own the premises and the business, but we're trying to offer to them consolidated resources, right? For example, like the marketing wise, the purchasing power. So we combine all the resources. So we offer them the good value of products. At the same time, also we use the internet thing, all right, to minimize a lot of errors.
Right.
Okay, so that the process of transmitting certain product from point A to point B will be smoother and with less cost.
But that also, when you talk about going online, using the internet, that itself is a training process for everyone.
Yep.
Now, coming back to what we're talking about, Malaysia Baru has seen a lot of changes. Now we're talking about a lot of change which with regards to managing costs while delivering improved outcomes to patients. Now, how do you see this happening in New Malaysia?
Yeah, when we look at all industry, especially in drugs, people are looking for cheaper products. To me, there's nothing cheap.
Right.
You've got to make sure that
people
it's
looking for cheaper products, or is it an Asian thing or an Asian thing for us?
I believe it's only in the mindset.
In the mindset.
We in Pharmaneca, we always emphasize on affordable medicine. Okay, when we come out with certain generic with affordable price, we look at many angles, right? The product itself, the development costs, but at the same time also we are trying to minimize the cost in terms of the process of putting the product right from the factory to the end users. So all those processes include there's a cost inclusivity.
Right. But in the market, in the world market, everyone will be clamoring for in the market space, saying a product, you've got a product that's being sold now, its patent is going to end, and it's already due to be to move into the generic line or the generic industry. Now, how does a company like Pharmaneca, being a Malaysian company, get into the market now?
Okay, when the patent, what we call the patented products in the market is quite available in many domains, because we know which particular product become off patent at a certain time. All right. Normally, people like us will get it prepared. All right. Let's say if there's an example of one product expired patent next year, we'll prepare ourselves much earlier in terms of formulation, in terms of the active raw material, the process. So when we prepare, we'll make sure that all the preliminary testing is done, so that we've got sufficient time to prepare the documents, to submit to the authority, so that we can get the approval on time, most likely just maybe a few months before the patent is off. And those people who do that, and they can enter the market, and they can get a first mover advantage in the market.
Now, the other thing is, to move fast in today's world, and as you were pointing out earlier on, the digital revolution is getting closer and closer with many changes. So we've got mobile communications, we've got the cloud, there's advanced analytics, there's also the IoT or the Internet of Things. Now, how do you see Pharmaneca, putting itself forward, or rather positioning itself with regards to digital initiatives?
Yes, we cannot go away without digital thing in our industry. All right, in Pharmaneca itself, we have started embarking into many areas. All right, even at the sales sites. Okay, we've got CRM thing. We got online ordering system from between us and the customer. And at the back end also, in the production, in the logistics, we also implement quite a number of systems to improve the processes, because all this digitalization of the process will reduce cost. Okay, so moving forward, the way we manage our resources, the manpower, we've got to be clear that digitalization is the in thing. So we must have a better, what we call technical expertise in terms of web designer, right? This online or internet technician thing, so that we can be way ahead of the others,
Right.
and make us better in terms of putting ourselves in the market space
Right.
instead of marketplace.
This in turn means that we need to bring in a younger generation of people
possible.
to make things work.
Yep.
And it will definitely see a lot of change with them coming in. Of
Yep.
course, as Tun Mahathir was pointing out at an interview, the younger people have the ideas, the older generation has the experience. So meld that together and you get quite a lethal force to work with.
Yep.
Now, with regards to Royal Pharma or Royale Pharma, there are a lot of people who are going out there and buying stuff online now that we're talking about what's happening online. So how does this affect the business model of Royal Pharma?
Okay, at the moment, we started Royal Pharma as a conventional pharmacy outlets. Okay, I think now we've got about 100 over alliances under the Royal Pharma umbrella. Moving forward, yes, we have gone into internet base, online sales. We are also into some platform like Lazada, Shopee. Okay. On top of that, our marketing and our branding activity, we also put it in our social media like Facebook, Instagram. So we are getting more and more products into online.
It's getting online, it's getting traction also?
Yes.
Yeah. Well, before I let you go, very quickly, what would be your advice to the viewers of Medical Today, people who've been following us from episode 1?
Okay, I believe Medical Today is a good tool for people to understand really their health-related information. Okay, it's better to have credible information compared to if you seek from the Dr. Google or something, right? So it's good for them to continue looking at this channel, all right? Moving forward, maybe they have more specific topics which is related to certain disease, certain category of people. So this, I believe, is a more credible way of getting the right information.
Right. And on that note, we'd like to thank Fabanyaga Berhad. We'd also like to thank you, Encik Zul, for taking time off your busy schedule to join us right here on Medical Today. Thank you so much. It was a pleasure and an honor to be with you on season 1.
Thank you.
Stay with us. We're going to take a short break. When we come back, we'll give you more right here in the final episode of Medical Today. Jared Ratnam with you on the Bernama News Channel. Welcome back to the final episode of the first season of Medical Day right here on BNC. From speaking to Zul Hasri, let's move into child developmental problems. Now, child development problems is a growing thing in Malaysia, and we spoke to Dr. Rajani Sarvanandan. She's a consultant general and developmental pediatrician who joined us to talk about child development problems. Let's take a look at what she had to say.
Well, when we talk about child developmental issues, it's often we're referring to children who may not be following the exact trajectory that we expect in terms of their developmental skills. For example, if a child has poor eye contact, is not pointing at things, is not starting to babble and imitate some of the noises that you make and actions that you make. These are all little warning signs that something is not right in their development. It may be more specifically autism or some other developmental issues such as a language delay or so.
Now, stroke is no longer for the old. Now, if you look at the world, young people are unaware of the risk of stroke these days. The most common cause of stroke in young adults is aneurysms. Now, we have a video on that. Let's take a look at this one.
An aneurysm, is how I put it to my patients sometimes, is like a balloon. It's a bulge from the blood vessel. It bulges out like a balloon. And as the balloon grows bigger, the walls become thinner, and it suddenly ruptures into the brain, causing severe headache or stroke.
From strokes, we move on to sports injuries. Now, sports has its advantages and disadvantages. Is sports dangerous for the knees? Dr. Sivakumar Araratnam spoke about sports injuries right here on Medical Today. Let's take a look at what he had to say.
The question of whether sports is dangerous for knees, I often get patients who come in, and when I tell them that, look, maybe you should start doing some sports, they always say, doctor, I've come to you with knee pain. Why are you telling me to do sports? Now, so the general belief is that sports is actually bad for your knees, but numerous studies have actually shown us that sports is indeed good for your knees. And it's not only, like for instance, if you take running, it's not only folks who have been running from the time they were young, but even people who take up running at a much later age. It's been shown to be good.
That was a little something on sports injuries right here on the final episode of Medical Today. We did speak to a fantastic doctor, a phenomenal man, Dr. Ainur Rahman, about cataract surgery, and he was so detailed in what he said about cataract surgery. Let's check out what Dr. Ainur had to say.
A cataract is a natural process and is an aging process whereby the natural lens in the eye starts to become cloudy. And if it becomes so cloudy that it prevents light from entering the eye, the patient literally becomes blind. This is a model of the eye. Just to orientate ourselves, this is the front part of the eye.
If you could just turn it forward. Yeah. Okay, so this is the
front part of the eye. This is the back part of the eye. The front part, we've got a clear tissue called the cornea, and behind here we've got the nerve, which is the wiring to the brain. In between these two structures, we've got the lens. Now this is the lens of the part of the eye which becomes cataractous. So in a young person it's all clear, but as we age it undergoes some aging changes, then
becomes opaque.
So I'll just show you.
So it's this lens that becomes opaque and not on the outside.
No, not the cornea. So from a clear lens to an opaque lens, create a perfectly round circle. I think the machine will beat any expert anytime. The other advantage of flex in terms of this opening is you can actually determine the exact sizing. This can be very useful if you use certain type of lenses.
From some interesting information about cataract surgery, we move into new hybrid treatments for cancers. Now, interventional oncology and the new targeted options is also one of the topics that's very hot in urban parts of Malaysia. Let's take a look at what Dr. Alex Tang had to say about this.
Well, in the management of cancerous diseases, we have four main pillars. The conventional one will be the medical oncology, who use chemo drugs to treat patients. Number two will be surgical oncology, who do debulking or cutting out the tumor. Number three will be radiation oncology, who use radiotherapy to kill the tumor. With the advent of the technology since the discovery of the X-ray in 1895, the current state-of-the-art technology and the computer system allowed the X-ray equipment or other systems like ultrasound or MRI to show the organs in a split of a second, and hence it's a real-time scanning process. And for that, many new devices, miniature tool, either tube, wire, needle, and tiny, we can say
gizmos.
Has been developed so that we can actually target a tumor precisely, either through the artery or the veins, or directly inserting a needle in, and that will be able to target and cure the cancer. This field is called interventional oncology.
From oncology, we now move on to heart disease or heart problems in Malaysia. In the modern world, there's a lot of these problems, and Dr. Chong Yun Sin, a consultant cardiologist, joined us to talk about treatment options for heart disease earlier in the first episodes of Medical Today. Let's take a look at what he had to say.
The treatment nowadays we have divided into three. One is medication, of course. Medication basically to thin the blood, to make the blood vessel more relaxed, lower the cholesterol level, lower the sugar levels, and lower the hypertension. The treatment, further treatment, let's say if it's a very tight cholesterol lesion, then we can always go for angioplasty, which is a balloon, put in a small balloon into the coronary artery or the heart. And nowadays it's actually very simplified. All right, it can be done in a daycare procedure. We give some painkiller on the wrist, all right, and then put a small needle, 1.8 mm plastic tube, 1.8 mm, and go straight to the heart, and we can find the blood vessels. And in order to proceed with the balloon, it takes about another 10 minutes, and that's it, all right, and it's done, and you go home 6 hours later. But if, let's say, certain cases, which is unfortunately multiple block, very complex, very difficult, we may suggest for a bypass, which is an open heart, that carry a bigger risk.
From the heart, we come back to sports again. We take a look at sports injuries. Dr. Shamsul Iskandar bin Hussein came in and he was in the studios talking to us about sports injuries. Playing sports and exercising can sometimes be dangerous. Let him tell you why.
First thing is you have to have a good, so-called, you have a strong and also healthy leg, meaning that you have always been on regular exercise, okay, to make it strong and to make it stable. And secondly, you must always be so-called you shouldn't be fatigued or you shouldn't be tired when you are involved in games, because when you are tired, there's a liability
that you get injured.
You get injured.
Right.
All right. And thirdly, when you are involved in sports, so-called the courtyard sports or the indoor games, it's a matter of your footwear.
Right.
Okay. Wearing the appropriate footwear, all those suitable shoes, and not wearing old steel shoes, those are actually preventing you from getting all these injuries.
This is Medical Today on BNC. Now, according to reports, colorectal cancer is the second most common cancer in males and the third most common cancer in females in Malaysia. Dr. Chen Han Chin, a consultant gastroenterologist, talks about it. Let's take a look at it. What are the signs and symptoms?
So
the actual red flags for us to go see a doctor.
So we have a few symptoms which we consider as red flags, which requires very prompt investigation.
Right.
But sadly, when you have these symptoms, most of the time, if it's a cancer, it's usually advanced. Yeah. So that's where screening comes in. So we try and pick it up before it becomes an advanced cancer. The red flag symptoms for colon cancer, we have a few. Firstly would be an altered bowel habit. So for example, if you are going to the toilet regularly once a day and suddenly you find that there's a change, you go to the toilet 2-3 times a day, you have runs of diarrhea, sometimes constipation, then that's what we consider as a change in your bowel habit.
Right.
And that
between diarrhea and constipation.
Yep.
Yep.
And also the stool consistency. And that happens in about 40% of patients when they present with colon cancer.
Thank you for staying with us on Medical Today, the final episode in the first season. We had Dr. Lim Boon Peng, a consultant orthopedic surgeon, one of the old cats, come in to talk about osteoporosis and bone health. When I say old, he's a wise man. He's been there. He's seen a lot. Let's take a look at what he has to say about how we don't take care of our bones.
I think osteoporosis is one of those that are not, is a disease that has not been recognized well enough in our culture, in everywhere in the world, especially Asia.
Right.
The problem with osteoporosis is this. Say it's a silent killer. It doesn't show you signs that it is deteriorating. It is basically a reduction of bone density, a failure of bone architecture, therefore leading to fragility fracture.
So now, going back to what you first said, after we're 40, most of us don't worry about what's going to come with regards to bone health. So we need to start thinking about this.
Yes,
right?
so in other words, you must think of those below 40, we have to make sure their exercise is good enough. See, bone are like muscle. If you exercise the muscle will build up, you become Arnold Schwarzenegger.
Right.
Bone is the same thing. You use them, you exercise more, your bone will say, hey, I need a stronger bone to take that weight, and your bone will build. And therefore that building part has to be below 40.
Right.
But how many of us are actually exercising enough, taking enough calcium, taking enough vitamin D?
See, there's a question here which is very interesting. Do Malaysian women need calcium and vitamin D supplements to prevent osteoporosis? Why aren't we targeting men?
That's because at menopause, okay, the hormone level drops, and therefore you find that the incidence of osteoporosis goes up exponentially after that. So during menopause, that is the time when the hormone has reduced, the female hormone, estrogen and progesterone. Your body is unable to bring the calcium and vitamin D into the bone and build it.
So it can't transport the...
You can't transport it in the layman term.
Along with a healthy diet and exercise, you can treat osteoporosis with medicines that help your bones to stay strong as possible for a long time. But before that, please visit your orthopedic surgeon to get a check now and again. From there, we take a look at epilepsy and the brain. Now, Dr. Shirini Ahmad, she joined us to talk about epilepsy and how chronic a disorder it is. This is what she had to say right here on Medical Today.
In a simple term, epilepsy is, imagine the brain has lots of electrical activities. So for epilepsy, there is an abnormal electrical activities in the brain that's causing brain to overfire. And this, as a result, can cause several symptoms on the patient. Talk about epilepsy is the minute we talk seizure, then we think about fitting. So jerking movement of the arms and legs, biting of the tongue, clenching of the teeth.
We'd like to thank all the doctors from Ramsay Sime Darby Healthcare who've joined us in the past 14 episodes to talk about various issues with regards to diseases and how to prevent them and how to lead a better lifestyle. We'll take a short break and come back with the final segment for you on the final episode of Medical Today right here on BNC. Welcome back to the final episode of Medical Today right here on the Bernama News channel. Well, before we wrap the first season of Medical Today, we had a phone conversation with the Group CEO of Ramsay Sime Darby Healthcare. Gregory Scott Brown joined us all the way from Australia, and he talked quite a bit or extensively about how he views the healthcare system moving forward in Malaysia and what he can do with his expertise and where he can take Ramsay Sime Darby Health to with regards to bringing more information and better health care to the people. Let's take a listen to this conversation.
So many people in the community were interested in the health programs, and it's very evident that the community wants to know more about the services that we provide, and there's great interest in particularly preventative health care and how the community can improve their health, and the ability to access healthcare services in Malaysia is also of great interest to the community, which is again exciting from Ramsay Sime Darby Healthcare's perspective, that we're able to make a difference and to support the community to improve their healthcare needs and access to healthcare needs. I support and Ramsay Sime Darby Healthcare support the concept of prevention is better than cure, and it's really important that we're able to make the community aware of the availability of primary healthcare, so that they can the community can improve their lifestyle and also their healthcare needs when they require it. And I suppose that is the really important thing from our perspective, that we obviously want the community to be better informed of prevention opportunities in the healthcare needs, and we in Ramsay Sime Darby Healthcare see the importance of that, and we're very happy to provide the access when required for the community. Okay, Ramsay Sime Darby are very conscious of the need to improve the overall healthcare quality in Malaysia, and the way we are doing this is ensuring that our patients have access to the best quality healthcare when they need it, and that is very important for us going forward to particularly improve access through IT and through technology, so that we've recently implemented a live chat and also an app for patients to make bookings with their healthcare specialists. And this is very important because they can actually look at what times are available to make appointments for their doctors. We have lots of information on our website, so that the community are in a position to access the specialist when and where they need it. We've got 3 hospitals in KL, and all our hospitals have live chat and apps to facilitate access to the specialists that work in their hospitals.
Well, that was Gregory Scott Brown, the CEO of Ramsay Sime Darby Healthcare, joining us over a phone conversation from Australia, talking about the various things that have happened in this very exciting first season of Medical Today right here on BNC. Of course, they came on board together with Farmer Niaga Berhad to make this a successful first season. Now, for those of you who are still looking for vitamins, all you have to do is send us an email. Send it to ask@medicaltoday.my, ask.medicaltoday@medicaltoday.my. Send it to us and we'll furnish you with a bottle of vitamins courtesy of Farmer Niaga Berhad. So just say, give us your name, some details, and we'll sort you out with some vitamins. On that note, I'm Jared Ratnam signing off for season 1 of Medical Today right here on the Bernama News channel. I certainly do hope that you enjoyed the first season that we had for you and the various doctors and experts who spoke on the show. You have a fantastic weekend and a great week ahead. Jared Ratnam signing off for season 1 of Medical Today.